Do you have advice for healthcare providers who might be considering an exploration of different technologies for their patients?
Yeah, they should. First of all, you should talk about incontinence with your patients. Anamnesis is the most important thing. I learned that as a doctor, and I use that technology in all my life. Ask questions. What's going on? What's the background? Also, you're going to treat an incontinent patient for high blood pressure with a diuretic. You're going to have a disaster. So you better know beforehand that this is the case. So you have to ask that, and how it affects them, and is there a background here? So I think that's the first, and I think doctors, medical doctors, incontinent. If you can't operate on it, they're not that interested. Surgeons, urologists are actually the ones that are responsible for it, um, um, and they like to operate. So if it's not invasive, not so interesting. So pelvic nurses like Julia, or physiotherapists in other countries, or urology nurses, they are probably a better partner. And I think we need to train the nurse population in how to deal with incontinence. Um, so I think that's where you have to adopt. That's who you have to address to adopt new things. And there should be protocols. There should be evaluation, and there should be time. And in the general crisis in the hospital system, this is a huge challenge because nurses are striking, underpaid. There are nurses for hire. There is no routine. How are you going to make a study if you don't have consistency in the healthcare system, people who are in one place and they know what protocols to use and so on. And I think if the healthcare system is not going to deal with that method of improving care and evaluating new devices that I mentioned many of them, it's going to cost more. We're going to just have a higher and higher healthcare cost, and higher. We have a baby boomer now. We have, the generation just above my generation. It's gigantic. It's going to just cost a lot of money. So that's my advice. There are methods for this, but if you don't have the underlying organization for it, it's not going to happen.